And good afternoon, and thank you for everyone who give me this opportunity to share my knowledge with you. I am Dr. Joan Jamal, an assistant professor at the University of Slemani, holding a PhD in orthodontic. I have over 70 years of experience in teaching and 20 years in clinical practice, and I have delivered many numerous presentations at national and international conferences. Today, my topic is about artificial intelligence in orthodontic challenges, innovation, and future perspective. What do you mean by artificial intelligence? We know that the artificial intelligence today is not a simply computational tool to design to replicate the human brain. Instead, it consists of collection of problem-solving tools, each operating according to its own specific set of rules. So what is the role of artificial intelligence or AI in modern orthodontics? All of us know that the modern orthodontics diagnosis, special diagnosis, is complex and it's cephalometric, dental, facial, skeletal analysis, and upper airway obstruction assessment. And with the use of the AI, this become very efficient and accurate. For example, we can have different programs for cephalometric analysis like WebCF, Ninja. We can use it for analyzing cephalometric radiograph. Also, we can use AI for craniofacial landmark digitalization. We know that it is difficult to digitalize craniofacial landmark in CBCT because it is three-dimensional. However, we have programs that can do this easily for you. As here in this picture, we can see it. Also can be used for dental analysis, as we have this program tell you where is the filling, the implant, if there is any infection or periodontal disease in the tooth. It can analyze all the OPG for you and give you a report about dental analysis of the patient. And also can be used, AI can be used in the diagnosis for facial analysis. The front view and profile of the patient can be uploaded to the program and analyze the soft tissue and profile of the patient for you. And one other method of the that we use in the diagnosis is prediction of the growth, especially for growth modification technique. Previously, Hunter's radiograph was used. Nowadays, we can use the lateral cephalometric and use the patient vertebra for prediction of the growth, the remaining growth for the patient, to do growth modification or not. By different AI technique, we can do this. Also, upper airway obstruction assessment is very important, especially in the patient with the open bite. So we can do this by AI technology. Also, temporomandibular dysfunction diagnosis, as here we see, we can be diagnosed by AI. And the second use of the AI in orthodontics is the treatment planning. We know that the treatment planning is difficult procedure, so all the diagnostic report can be uploaded to different AI program, and according to that, they put treatment plan for the human being. One of the difficult decisions in the treatment plan is tooth extraction, especially for early orthodontists or inexperienced orthodontists. There is a program that decides for you to do extraction or to not do extraction, and this prevents the incorrect extraction protocol. And The second use of the AI in treatment planning is orthodontic surgery planning. All of us know that there is a surgical guide for orthodontic surgery and lead to precision in the procedure, and the surgeon can do very correctly the surgery without any hesitation, because there is a guide and guide the surgery during the guide the surgeon, sorry, during the surgery. And you know that the patient, especially those do orthodontic surgery, they are hesitate and they want to predict the result of the surgery because they change their facial form. So there is a program that there is a prediction of the patient outcome after surgery. We can show the picture to the patient, and by this the patient can be more comfort and do surgery more comfortably. And now robotic surgery go to the orthodontic surgery like any other part, like gynecologic and cardiothoracic and various general surgery field. And of course, if robotic surgery were used, this increased lower infection risk. There is a lower infection risk while simultaneously achieving greater precision in jaw movement. Also, we can use AI in our clinical practice. How? First of all, to monitor tooth root position. We know that the tooth root must be parallel at the end of the treatment, and we should monitor it during the treatment, but this need frequent radiation exposure to the patient. Well, if you have the pre-treatment CBT scan of the patient, and at any stage of the procedure, you can make intraoral scanner for the patient, and by combining the tooth crown position from intraoral scanner, the root can be predicted in the CBCT of the patient, and by this we can predict the root position of the patient. As here we have expected root position as post-treatment. This just by combining pre-treatment CBCT and intraoral scanner of the root of the patient. Also, for remote care, tele-dentistry, or for our specialty, teleorthodontic, now become revolutionized, especially after COVID, and this allow to have timely feedback and treatment progress tracking without the need for unnecessary in-person visits. The patient at the home can take, with or without scanner, can take a photo of her or his teeth to you, and you may have a platform and check the patient progress, or if the patient have problem without the patient need to come to your clinic. Also for clinical documentation. As you know that the orthodontic is very difficult to be document all the file, because it needs photograph, radiograph, class, and many other diagnostic procedure. While there is a different AI procedures that document each patient and classify for you very easily, and just by searching the name of the patient or report can come to you and classify the patient for you, which patient is class 1, class 2, class 3, and this is very easy in your clinical documentation and in the practice. And of course, AI have a role in evidence-based research and education. How? We know that if the pyramid of the research, systematic review and meta-analysis is at the top of the pyramid, because this have evidence, clinical evidence, this research. But of course, it is difficult to be conducted and need to research all literature and then analyze it. And it's very difficult to be done by the human being. However, nowadays there is a program that can make this for you and make this very easy for you. Also, in education, AI can be used in different parts of education, and orthodontics is not exception from that. For example, you can use it for personalized learning system. What do you mean by that? By that, AI adapt education material to each student learning pace and style, and can provide real-time feedback. Also, simulation and virtual reality. We have VR. Most of our children now use VR, and can be used in the education for and to enable to practice on virtual patient with different malocclusion scenario for our student. Also, assessment and evaluation by AI. We can assess our student and to know how accurately diagnose the patient and the procedure skill. Also, for curriculum evolution, AI literacy, data analytic, and robotic system management. By AI, we can do this. So where are we now? As we know that we are at the stage of digital aligner and 3D printing, AI-assisted diagnosis and planning, virtual monitoring, and teleorthodontics. So why AI and all these programs, this advanced program, not present in every clinic? Because we have challenges that I highlighted. One of them is that data security and privacy. The second is high cost of AI system. And the third is need for continuous professional training. And the fourth one is misapplication risk. So now the question may come to the mind of most of us. What would happen to the field of orthodontics if humans were to lose control over artificial intelligence? Not orthodontic, any field. First of all, loss of clinical safety. There may be diagnostic error, treatment planning error, and device manufacturing error will occur. Also, ethical and legal chaos. What do you mean by this? For example, if in the treatment plan something will go wrong, who is responsible? Orthodontics or the AI system? If the treatment plan was put by the AI, so no one can be accused for this wrong treatment plan. So this leads to decrease in patient trust. And also the third point is the evaluation of human expertise. Over reliance on AI make the orthodontist as a bottom pusher rather than skilled clinician. Also, standardization may push a one-size-fits-all. What do you mean by that? It means ignoring artistry and customization that true orthodontists require for ideal facial, dental, and skeletal harmony. Also, lead to economic disruption, of course, lead to job creation and lead to clinical closure, especially for new orthodontists that have no many patients and for less experienced one. Also, potential for innovation or disaster. If it is used with the human lead to innovation, however, AI without human lead to disaster. It means without human control. So in short, without human control, AI in orthodontics can lead to a crisis of safety, ethics, trust, and professional identity. So what is the future? What is the future of AI in orthodontics? First of all, genetic and personalized orthodontics. Why genetic? You know that genetic influence craniofacial development and malocclusion, especially skeletal class 2 and class 3. So also genetic influence dental anomaly like tooth agenesis, tooth size and shape variation, and eruption disturbance. An example is the primary failure of eruption. Again, genetic have influences on external apical root resorption, especially during orthodontic treatment. But we are now just to use genetics to predict growth cut and to size shape. However, and identifying individual at higher risk for treatment-related complication. The future direction in the genetics used in orthodontic is that through genetic testing to correct craniofacial anomaly at molecular level and whole genome analysis to customize comprehensive orthodontic plans. The second, advances in functional appliances. We know functional appliances is very useful appliances, but have limitation. What are the limitations? Is bulky appliances and uncomfortable for patients, aesthetically displeasing, and highly dependent on patient compliance for success. The future direction for functional appliance will be personalized functional appliance by 3D functional scanning and CBCT. You can make a functional appliance design the patient's skeletal and soft tissue anatomy. It is customized appliance for each patient. Also, bioactive and smart materials. The second direction will be bioactive and smart material. What do you mean by that? Biomimic materials. Example, bioactive ceramic could be incorporated in functional appliance and enhance skeletal response. Also, self-adjusting appliance. What do you mean by that? Future development incorporate flexible material or micromechanics that adjust floor level automatically based on patient growth phase. And remote monitoring and AI support, we say that one limitation is patient cooperation for using a functional appliance. However, we can incorporate a sensor, your type sensor on the functional appliance, and by this, give a report to the orthodontist how the patient comply with the appliance and how much he or she uses it. The fourth direction is genetic and biomarker guided treatment. What do you mean by that? In future, genetic testing could identify patients with high or low mandibular growth potential. Also, biomarker analysis, example, saliva test may help clinicians decide the optimal timing for initiate functional appliance therapy and offer this improved outcome for the patient. And the third future direction is convergence of orthodontic and aesthetic treatment. We know that historically orthodontic treatment primarily been to correct malocclusion to ensure functional occlusion. I mean, it focuses just on occlusion and, of course, to prevent periodontal or temporomandibular damage. However, contemporary patients often seek orthodontic just not for function, also for aesthetic, as aesthetic demand is increased for each individual nowadays, and they want to improve their smile appearance, facial profile, and to harmonize their dental and soft tissue structures. So you should not focus just on the correction of the occlusion of the teeth. You should also focus on the tooth whitening, tooth ratio, gingival health. Also, sometimes Botox and filler can be prescribed to the patient so that overall patient aesthetic will be improved at the end of the orthodontic treatment. By digital advancement, we can make digital smile design, 3D imaging, facial scan, and AI-assisted treatment plan to predict smile transformation and virtual treatment simulation and enhance communication between clinician and patient. So what is the future direction in this field of convergence of aesthetic and occlusion in orthodontic treatment? First of all, orthodontic and aesthetic are converging into a unified approach, must be converged to a unified approach. And the future orthodontist must merge biomechanics with artistic design and facial aesthetic. This is a must, become must. And the third is future digital occlusal analysis, and not ignore occlusion. There might be future digital occlusal analysis which is integrated with CBCT or intraoral scanner to digital treatment planning software. Also, you may have smart bracket or aligner embedded with force sensor, could continuously monitor occlusal contact during treatment. So AI-based facial aesthetic algorithm and 3D facial scan will guide clinician toward customized, natural-looking results tailored to each patient unit anatomy. The fourth advances that the future research focus will be robotic orthodontics. We know just the robotic technology is used just at the laboratory level and manufacturing level and not go to the orthodontic clinician. And it just will be robotic wire bending, indirect bonding system, aligner fabrication, and orthodontic simulation software. So the future direction in the robotic orthodontic will be chairside robotic procedure. What chairside robotic can do for the orthodontist can place bracket with micron level precision, adjusting hardware automatically based on real-time 3D scan, also apply functional appliance or attachment for aligner, and minimum invasive surgery can be done. What do you mean by minimum invasive surgery? Like placement of that or corticotomy. This can be done by robotic arm in the future. And secondly, fully automated aligner system. It means robotic system could scan, design, fabricate, and deliver some same-day aligner customized to life's intraoral condition. Also, dynamic aligner. What do you mean by dynamic aligner? Future smart material integrated with robot could produce aligners that adapt their force level based on tooth movement without manual switching by the patient. And tele-robotic and remote treatment, of course, tele-dentistry and tele-orthodontics will be featured for each branch and each innovation, and tele-robotic allow to diagnose, adjust appliance, and monitor treatment without requiring patient to visit clinic frequently. And of course, this is very useful for rural or underserved area, improving access to orthodontic care in all these areas that are underserved or rural area, which is far from orthodontists. And robotic ear retention and long treatment monitoring. Post-treatment retention phase could benefit from smart robotic retainer. What do you mean by smart robotic retainer? Which is self-adjusting to monitor relaxed movement, sending real-time data to orthodontists about compliance and tooth stability, and robotic monitoring platform could predict and prevent relapse by initiating early intervention protocols. So if this happen, it become very good for the orthodontic and for the field. If this innovation all become true in the future. So in conclusion, we can say the future is not man versus machine. It is man and machine shaping the future together. And AI and robotic are redefining, not replacing orthodontics, but orthodontists who embrace AI, robotic, and personalized treatment will replace those who do not. Any questions? This is my contact information for anyone who wanted. Thank you for your time and for your attention.